8:15 Thursday morning, May 12th. According to the CDC, chronic pain affects about 50 million U.S. adults and is one of the most common reasons adults seek medical care. Dr. B joins us now, our friend Dr. Brent Wallis from People's Health, to discuss the different types of pain and when it's best to see a doctor to help manage that pain. How you doing, Doc?
Hey, Tommy, I'm doing great. How about you?
Good. I got bad news for you. No Jazz Fest this weekend.
No, I know, but we had a great couple of weekends in a row.
Yeah, you can rest up. Chronic pain is a kind of vague term, Doc. How do you describe it?
Yeah, it definitely is. So pain as a symptom is really just anything caused by an injury or possibly an illness, and we classify it as either acute or chronic. And acute pain is kind of that sharp, sudden pain you get possibly when you trip and fall or hurt yourself. Chronic pain is different, though. It's actually something that lasts longer than 3 months. And what your body is really doing is it's trying to tell you that there's a continual injury going on or perhaps an illness that really needs to be treated and addressed. And there are actually 7 different types of chronic pain.
I had no earthly idea that was true. What are the different types?
Yeah, so, we break it up into 7 different areas, and I'll kind of run through them. The first one is called somatic pain. Somatic just really means kind of all over your body, your skin and muscles in particular, and that's probably one of the most common types of pain we see. Some examples would be back pain or fibromyalgia. The second type is something called visceral pain, and visceral pain is a little bit more difficult to determine where it's coming from because it's the nerves that surround your internal organs. So if you had a kidney stone, for example, that may refer pain to your back. Stomach upset is another one that's real common. And then the third type is muscle spasm, very common, especially this time of year. That's Charlie horses and, things caused by dehydration. The fourth type is bone pain. And bone pain, obviously, if something happens to a bone like a fracture, that's going to be extremely painful. But some other things we look at is arthritis, or even a certain type of bone cancer can cause a lot of bone pain. And then the fifth type is headaches, very common, either caused by migraines, tension, or even sinusitis can cause that. And then the sixth type is anything related to the circulatory system. So when you don't get enough blood flow to your tissues and muscles, that can actually cause pain. And we see that real commonly in people that smoke cigarettes or people that have really high cholesterol. And then the last type is neuropathic pain or something called neuropathy. And that's very common in diabetics. It's any pain along a nerve pathway. Probably the most common type we see, though, is something simple like sciatica, which causes pain from your back radiating down into your leg.
When do you see a doctor about this?
Yeah, it's tough to tell because, simple pains or minor pain, especially after an injury, is probably nothing to worry about. It should go away on its own. But we do look for certain red flags. So anything, that's out of the ordinary. So if you have pain that's associated with numbness or tingling, especially if it's associated with weakness, that's something to be really concerned about. And then in particular, pain associated with fever is never normal, or weight loss. So if you have any of those types of symptoms along with your pain, you definitely want to talk to your doctor about that.
How do you measure pain, and how do you determine within yourself if it's one of those 7, which one of those 7 it is, if it's chronic?
Yeah, so, the way we measure pain is, typically if you go to the doctor, you've probably been asked, are you having any pain? Can you rate it on a scale from 1 to 10? Some clinics may use, sad faces to happy faces, especially in our pediatric population. But it's a real subjective type of measurement because everyone experiences pain differently. So sometimes we'll use the World Health Organization pain ladder. And it's called a ladder because there's really 3 steps to it. There's mild, moderate, and severe pain. And so mild pain is really pain that goes away on its own, either with no therapy at all or over-the-counter medications. Moderate pain actually can limit your function, but it does go away with treatment. It may require a slightly stronger medication or some therapies but it will go away. And then severe pain really interferes with all your activities of daily living. It may require you to stay in bed. It can be very severe and doesn't necessarily go away. So, you asked about how do you know what type of pain it is. It's very difficult to determine where it's coming from, and that's why it's so important to be truthful with your doctor about your pain level so we can tease out which one of those 7 may be causing your pain.
All right, we take a break. We come back. We'll talk about opioids and addiction, which is a huge problem in the country. We're talking to Dr. B, Dr. Brent Wallis, about chronic pain. 50 million Americans, it's estimated, suffer with that on a daily basis. 8:20, time for traffic now on WWL. 8:25, Tommy Tucker, WWL, talking to our friend Dr. Brent Wallis, Dr. B from People's Health, about chronic pain that affects approximately 50 million people, and we've already talked about the 7 types of chronic pain, but when it comes to opioids, Doc, and addiction, how serious is it, and what are some of the other complications?
Yeah, the opioid crisis is it's a serious epidemic, and when we treat chronic pain, keep in mind that opiates are not the only treatment, and we try to use them very sparingly, if at all. There are a lot of other anti-inflammatory type medications and other medications that can be used for pain. If you are placed on opiates, you definitely want to talk to your physician about what the potential side effects are. For most adults on a short course of opiates who really don't have a previous addiction issue, it usually won't cause too many problems, but certain individuals can, develop serious issues and addiction problems with those medicines. The problem with those medicines, too, is they cause a lot of other problems, things like constipation. They cause pretty serious dizziness and sleepiness as well. And then it can cause nausea and vomiting. So, so they're not great medications to use if you can treat your pain with something else. That's why it's so important to know what the root cause is so you can address that root cause.
I would imagine if you're hurting every day of your life, that's going to eventually lead to some depression as well.
Yeah, it definitely does. In fact, probably about 60% of people who have chronic pain also have problems with depression. And, and chronic pain itself can cause depression, but then depression can actually change your perception of your pain. It can actually make you feel worse if you are depressed. And so it's really important to treat the depression as well as the pain. And some of the antidepressants that we use actually help with pain as well. So again, that's why you have to really work with your physician so they can understand what the problem is, how severe it is, and the best way to approach treatment for it.
Some people have a hard time falling asleep as it is. Chronic pain, I would think, makes that even more difficult. What are some ways to manage that?
Yeah, chronic pain definitely disturbs sleep. For most people, 2/3 of people have a sleep disorder, and so what we tell them is there's really a lot of sleep hygiene things that you can do. You should definitely avoid any caffeinated drinks before bedtime. I tell people, too, don't exercise right before bed. That activates your body, and while it's very good for you and can help chronic pain, it actually will cause a lot of problems falling asleep. Definitely don't eat too much, and don't drink alcohol or smoke close to bedtime as well. The best way you can actually get into the mode for sleep can be exercising during the day, which can actually be very helpful and make you a little bit more tired at bedtime. Taking a warm bath or drinking a warm beverage can definitely help. And then I know a lot of people do it, but trying not to watch too much TV or use your phone close to bedtime, that actually activates your brain and keeps you awake. So you really want to have a nice, good sleep environment, a dark room, cool pillow, everything that you can do to try to help you sleep, because if you get a better night's sleep, you're going to feel better the next day and hopefully reduce that chronic pain.
Doctor, one thing I've noticed is that when I don't exercise, it hurts. When I do exercise, it doesn't. That seems counterintuitive. You also always obviously want to check with your doctor, but sometimes the answer is to work through it, right?
Yeah, definitely. I mean, a major type of therapy we use for chronic pain is physical therapy, which is directed exercise, and mild to moderate exercise, so nothing too strenuous, can actually really help with chronic pain. It can actually help with some of that neuropathic pain, help to strengthen your muscles, and really make you feel better, so that your perception of that pain decreases as well. So it's something very good to do, but definitely do it under the direction of your physician.
Thank you, Doctor. I appreciate your time. Hope you have a good weekend.
Thanks, Tommy. You too.
All right, to find out more about People's Health, you can always go to peopleshealth.com. You can visit the People's Health United Healthcare Medicare Center at 3017 Vets in Metairie. That's right next to Party City. Appointments are recommended, but walk-ins are welcome. You can call 800-978-9765, and you can always follow People's Health on Facebook, Twitter, and Instagram.